The next virus family we're going to talk about are the papilloma viruses. Of course, most important for these viruses is going to be HPV, human papilloma virus. These viruses are also naked viruses, so they're extremely sturdy, and I'll talk about that in just a little bit. Now, also in this family are two additional viruses, the BK virus and the JC virus. Well, BK and JC viruses typically cause infection in immune-compromised patients. So we're first going to spend the bulk of our time talking about HPV, and then we'll wrap up the discussion of this family by talking about the BK and JC viruses. What are some distinguishing features for HPV? There are multiple serotypes, and there are some serotypes that you definitely need to know. Certain serotypes are associated more commonly with the presentation of cutaneous warts or plantar warts, whereas other serotypes are more often associated with genital infections from HPV. The reservoir for HPV is going to be the skin for cutaneous warts, and of course that's sexually transmitted, so the reservoir will be the genitals of both males and females. Transmission, again, direct contact or fomites. Why fomites? Because it's a naked virus, remember, so it's extremely sturdy. And of course, sexual contact. Now, as far as the pathogenesis, there are a couple things to think about here. From the time point where you initially come in contact with the wart to the time of the presentation of the actual wart takes a good deal of time, probably anywhere between maybe 3 to 6 months for that wart to appear. What happens is the virus infects that basal layer of the skin and mucous membranes and causes hyperkeratosis, which eventually leads to that very obvious clinical presentation of the wart. Now, the other thing that you have to be aware of is that HPV, just like HBV and HCV, is also linked to malignancy. So that makes it extremely important. Now, specifically, you need to know which proteins the virus makes that interfere with the tumor suppressor gene. So you want to know the mechanism of how HPV is associated with malignancy. That is because the virus makes two proteins, E6 and E7, that interfere with your tumor suppressor gene. So your normal genes that help control cell replication. Now, when E6 and E7 interfere with your tumor suppressors, P53 and RB, you have the uncontrolled, unregulated growth of cells. Okay, now we're going to look at some of the diseases a little bit. I mentioned that HPV, of course, human papillomavirus, causes warts, all different types of warts. Cutaneous warts are typically from serotypes 2 and 4. Not essential for you to know the serotypes for these particular ones we're talking about, but when we get to the genital infections, you absolutely have to know the serotypes. Okay? Common warts are typically found on the hands and fingers. Kids are usually the ones that get the warts, at least the common warts. Plantar's warts as well are usually on the soles of the feet, and they can be very, very deep, and they can be associated with a lot of pain. So they're not as easy to treat with some of those over-the-counter remedies as the common warts because they are a little bit deeper and associated with some pain. Now, genital warts, the term for genital warts is condylomata acuminata. If you say that really quickly, you might get it confused with Hakuna Matata. So if you saw The Lion King, you know what Hakuna Matata means? It means no worries. This definitely does not mean no worries. So don't get them confused. Okay? Condylomata acuminata is the clinical presentation for genital warts. A couple of other things you need to think about with the genital warts is you can also get the formation of laryngeal warts or laryngeal papillomas. Here's an example. You have an infant that's born to a mother who's HPV positive. As the infant travels through the birth canal, they aspirate the virus and they can develop laryngeal warts that may be obstructive and have to be surgically removed. You can also find laryngeal papillomas in sexually active adults, and again, they can be obstructive and may require surgery to remove them. The thing to think about with warts, cutaneous warts, genital warts, is those warts are infectious. There is live virus in those warts, okay? So touching somebody that has a wart may transmit that. Touching some table or piece of equipment that somebody that had a wart touched, again, can transmit it. So I always think this is kind of scary because ladies, when we get pedis, we get pedicures, you're in there, they clean it because you watch them, right? They clean out in that nice little spa chair that you sit in. They clean it out, but this is a really stable virus. So what happens? Sometimes, I don't know about you, but sometimes for me, they actually cut me. And if there was HPV at some point in that little bucket that you keep your feet in, it can inoculate and you can get an HPV infection in your feet, okay? So that's cutaneous warts. Now, what you have to remember is I told you that you had to know the serotypes for the genital warts. Serotypes 6 and 11 are the most common serotypes of HPV that cause genital infections, 6 and 11. However, serotypes 16 and 18, and to a lesser extent 31 and 35, are the serotypes associated with cervical cancer. So what did we talk about? We said anytime there was an agent associated with cancer, bumped it up to high yield. So you need to know that serotypes 6 and 11 are most common, but if you have 16 and 18, those are associated with cell transformation and cervical cancer. How close of an association is there with cervical cancer and HPV infection? If you look at the second to the last bullet point, 95% of individuals with cervical neoplasia, if you go back and look and do molecular analysis, you will find HPV DNA. Okay, so there is a very high association with genital HPV and cervical cancer in women. The last bullet point speaks to the mechanism of transformation by HPV, and we've really already kind of discussed that it's the E6 and E7 proteins that inhibit P53 and RB. Now, diagnosis is important for HPV. Again, what I mentioned about for viruses, I said we have no gram stain and what? We have no culture. So we have to go to our friends, the pathologists, to be able to really definitively diagnose a lot of these viral infections. If you're reading a vignette and they mention that on Pap smear they found coilocytic cells, that is definitive diagnosis for HPV infection. Now, alternatively, again, they can show you an image, okay? And what I'm showing you here is an image, okay, showing what coilocytic cells look like. So the blue cells, okay, are the coilocytes, and actually this pink one at the top is also coilocytic. These are normal vaginal epithelial cells. You can see the nucleus is small. There's no vacuole around the nucleus. But if you look at, let's say, this blue cell here and then this pink one up here, you see an enlarged nucleus and you see a perinuclear vacuolization. That is what a coilocyte is, and in addition to knowing the description, you should be able to recognize an image of a coilocyte because they can just as easily now show you an image as they can describe it for you. Treatment for HPV, we do have supportive things that we can do, but we also have antiviral agents that we can use. Typically, what we're going to do for an HPV infection is supportive. We're going to burn it off, freeze it off, chemically burn it off. But we do have more specific therapies now. We have imiquimod, which is an agent that can help induce an inflammatory immune response to alert the immune response to come and look for the virus. We have interferons, but interferon's not something you generally want to use because a lot of the times the symptoms from the interferon are worse than the actual viral infection itself. So except for in a case of chronic type infections like for Hep B and Hep C, you're probably going to want to stay away from the interferon. It's not going to be your drug of choice. There is also cidofovir, which is an antiviral agent that they're using now to treat HPV. Prevention, as far as HPV is concerned, we have a pretty new vaccine called Gardasil. It covers the two most common serotypes associated with HPV genital infections, so that's 6 and 11, but it also covers 16 and 18, which remember are the serotypes most often associated with transformation and cervical cancer. So in effect, what this vaccine can do eventually is be able to prevent cancer in young females who get this vaccine. The vaccine itself is a recombinant vaccine, much like the hepatitis B vaccine is. As far as other mechanisms of prevention, again, for sexually transmitted disease, it always goes back to abstinence and safe sex practices.